Informed consent for root canal treatment. Introduction. Root canal treatment is a procedure to save a tooth that's badly damaged or infected. The inside of your tooth, called the pulp, contains nerves and blood vessels. When this area gets infected, it can cause pain and swelling. Root canal treatment removes the infected pulp, cleans the inside of the tooth, and seals it up. This relieves pain, stops the infection from spreading, and saves the tooth. Why? There are several reasons why your dentist might recommend root canal treatment. The most common ones include 1. Deep decay. The white parts here are enamel. This is like the arm, all the helmet of the tooth. It's hard and protect the teeth. Here, the light gray, this is the dentin, the soft inside, and the dark line here is the nerve, the heart of the tooth. For example, this is what a healthy tooth looks like, and this is your tooth. These dark areas on these 3 teeth are cavities. Here on this tooth, that dark area, that decay, is actually reached the nerve. This is why you're getting pain. If you have a cavity that goes untreated, it can eventually reach the inner part of your tooth, called the pulp. This contains sensitive nerves and blood vessels. Once bacteria infect the pulp, it can cause pain, swelling, and even an abscess. 2. Trauma or fractured tooth. A crack or a fracture in your tooth can extend down into the pulp. This provides a pathway for bacteria to enter, causing infection and pain. A hard blow to your tooth, even if it doesn't cause a visible crack, can damage the pulp inside. This damage might not show up immediately, but over time it can lead to infection and the need for root canal treatment. 3. Repeated dental procedures. Sometimes multiple dental procedures on the same tooth can irritate the pulp over time, leading to inflammation and the need for root canal treatment. Risks of root canal treatment. Like any dental procedure, root canal treatment carries some potential risks. These risks include post-treatment, pain, and swelling. You might experience some tenderness in the treated area for a few days. Instrument breakage. Very rarely, a tiny file used during the procedure may break inside the tooth. Rare cases where the root canal anatomy is complex or obstructed. Tooth discoloration. The treated tooth may slightly change color. Tooth fracture. The tooth may become brittle and prone to fracture over time. Prognosis. A good root canal and a good restoration has a 5-year survival rate of 90%. A good root canal without a good restoration has a 5-year survival rate of 60%. It is better to have a good restoration and bad root canal than a good root canal and a bad restoration. A bad root canal and a bad restoration is the worst. Rewards of root canal treatment. Root canal treatment offers several important benefits. Saves your natural tooth, avoiding the need for extraction and replacement. Root canal treatment allows you to keep your natural tooth, which is important for chewing, maintaining a natural smile, and preventing your other teeth from shifting. Eliminates pain and swelling. Root canal treatment relieves the severe pain caused by an infected tooth. Prevents infection spread. By removing the infection, root canal treatment stops it from spreading to other teeth or even to your jawbone. Understanding the alternatives. The main alternative to root canal treatment is tooth extraction. While removing the tooth might seem like a simpler solution, it's important to understand it has long-term consequences. These can include shifting teeth. Losing a tooth creates a gap that can cause surrounding teeth to shift, affecting your bite and smile. Bone loss. The jawbone needs stimulation from your tooth root to stay healthy. A missing tooth can lead to bone loss over time. Need for replacements. To restore your ability to eat and speak properly, you may need a dental bridge, implant, or denture, which can be costly. Other alternative is observation, accepting the risks associated with not treating the tooth. Procedure. Here's what you can expect during a root canal treatment. Numbing the area. Your dentist will first inject a local anesthetic to numb the tooth and surrounding area, making the procedure painless. Placing a rubber dam. Accessing the infection, your dentist will make a small opening in your tooth to reach the infected pulp inside. Cleaning, shaping, and disinfecting the canals. Using tiny instruments, your dentist will carefully remove the infected pulp and thoroughly clean the inside of your tooth's canals to remove any bacteria. Filling and sealing. Your dentist will fill the canals with a special material called gutta percha to prevent reinfection. They will then seal the tooth to close the opening. Possible restoration. Depending on the damage to your tooth, your dentist might place a filling or crown on top of the tooth to restore its strength and appearance.